Hello all, this is Dr. Rup Kumar. Welcome back to another masterclass series from Dentospedia. Today we are dealing with the third session of oral radiology, and today's topic is about film processing. Film processing is a collective term, used for series of operations which bring about chemical changes in exposed film and thus making the image visible and permanent. Okay, here after exposure of the film, we have to develop the film, right? It has to undergo certain reactions to get the final permanent image. Okay, and the first step in the formation of permanent radiographic image is the formation of latent image. Okay, just after the exposure, the film contains certain translucent, the hazy image called latent image. Okay, and this image, when we develop with certain chemicals like developer and fixer, okay, we will get the final permanent image. So the opening of the film has to be done in the dark room because the latent image with the film in the film is very sensitive to visible light. Okay, so that's why we have to be very careful during the film processing. So we are dealing with the film processing, right? And the formation of latent image is the first step. The film emulsion contains positive silver and negative bromine ions that are arranged in a geometric pattern, and this pattern is called crystal lattice. So we have discussed, right, the different layers in the film, right? We have different layers. Among those layers, film emulsion layer is a very important layer, and this layer contains silver halide crystals. And these crystals, mainly silver bromide crystals are majority, okay? And they are arranged in a structure called crystal lattice. And when these silver bromide crystals are exposed to X-rays, some of the bromine ions present in the lattice, they emit electrons. Okay, and these electrons travel through the crystal lattice with a high mobility and get into certain locations called electron traps. Okay, you can see in this picture there are certain areas called electron sensitive areas, or we can say electron speck areas, or you can say electron trap areas. So when we expose the crystal lattice with the X-rays, the bromide ions will emit the electrons. The electrons will be, they get detached from the atoms, that is bromine ions, okay, and then they attract it towards certain areas called sensitivity areas, or we can say electron speck areas. And these electron speck areas, okay, and this is where the electrons will be pulled, okay. The electron trap is a region of low energy in the crystal. It is also called sensitivity speck area. As the electrons are trapped, there is a negative charge in the speck area, and this is the stage 1 in the formation of latent image. So when the X-rays are exposed and these electrons, they get trapped in certain areas called sensitivity speck areas. And silver ions, they are positive, right? They get attracted towards the negative electrons. Okay, and there are certain areas, right? And these areas are kind of negative in nature because all the electrons are pulled in this area. And silver ions, they are positive in nature. They get attracted towards the negative electrons. Okay, they go direct towards the negative electrons. Okay, and when silver ions are represented by Ag plus, right? It means it has lost one electron. So it tries to gain electron and get stable. We have discussed, right, the basic differences between ions and atoms. So when an atom is converted to ion, it either loses electron or gains electron. And also ions, they are highly unstable in nature and they try to get stable by either losing electron or gaining electron. Okay, so Ag plus means it has lost an electron. Okay, Ag plus means Ag plus 1. So it has lost an electron during the conversion from atom to ion. So it has to go back to atom state to get stability. So it tries to gain electron. So when the electrons are present in certain areas called electron spec areas, and these Ag plus ions, they get attracted towards electrons in getting the electron and to get stable. Okay, and this is what occurring. So the Ag plus ions, they accept an electron and they get converted into silver atoms. Okay, and wherever the electrons are present, the Ag plus will get attracted and they are converting into silver atoms. So here Ag plus is converting into Ag atom, that is silver atom. Okay, and this cycle, the whole process occurs in fraction of seconds. And wherever the Ag is present, that is silver atom is present, it is the film contains blackness in that area. So wherever silver is present, silver atoms are present, the area will be darker. I mean the blackness in the radiographic image. Okay, here you can see the Ag plus is converted into Ag atom, silver atom, and wherever the Ag is present, there will be blackness in the latent image. Okay, and wherever the radiolucent C is present, it means the X-rays are not exposed. They did not touch the film in that areas. So wherever the X-rays touch the film, it is represented by blackness. Okay, and why it is due to why it is black? It is mainly because of presence of silver atoms. Okay, so this is the whole process which is occurring in a fraction of seconds. So during the exposure, X-rays are touching the human tissues. Okay, and they have the ionization property, and there are electrons in the emulsion layer, right? They hit the human tissue and then they hit the film, right? And in the film we have the emulsion layer, and in the emulsion layer we have silver halide crystals, and the bromine ion has electrons, right? And these electrons, they get kicked out of the ion, and they get attracted towards certain areas called electron spec areas. Okay, the electrons aggregate, and Ag plus ions, they get attracted towards electrons and they converted into silver atoms. So wherever the silver atoms are present, it is represented by blackness in the film, in the latent image. Okay, and this is the whole process of latent image formation. And then we take the film, the undeveloped film, into the dark room, and then we open the film packet and then we process the film. So we open the film packet and then we dip into the developer solution. Okay, and then we clean the film with water, rinse with water, and then we again dip the film in the fixer for a certain duration, around 10 to 15 seconds, and then we clean it and dry it. And that's how we get the final radiographic image. So these are the steps are occurring in dark room, and these are the steps occurring during the exposure. Okay, in a nutshell, we have discussed, right? Developer is a chemical solution. It is involved in the process of film processing. Okay, and what is the function of developer? There are many important points regarding the developer, and the most important point is it provides electrons to the Ag plus. So it is acting as an electron donor. So wherever when we supply electrons, the more silver ions are getting converted into silver atoms, right? So there will be more blackness areas, in the film. So this is the function of developer. And fixer, what does it do? It removes the unexposed silver halide crystals. So wherever there is, the radiolucent areas, the pure whitish areas in the radiographic film, that is mainly due to removal of unexposed silver halide crystals. And wherever the blackness is present is mainly due to silver atoms. Okay, and developer, it has its own functioning and fixer has its own function. And this is about film processing, and this is the end of the session, and we'll meet again in another session with another topic. Thank you.